Hello everyone, it is 11 months post-op. For those of you who are new to my channel, thank you for watching. My name is Dylan. I am from the Chicago suburbs and I have a plethora of rare disorders that I blog about. And my most recent book is about pudendal nerve decompression surgery, which I underwent in March of 2020 with Dr. Michael Hibner. For those of you who are not aware, I have a condition called pudendal nerve entrapment syndrome. The pudendal nerve is the main nerve in the pelvis that's responsible for the control of the pelvic floor. I was dealing with neuropathic pain, stabbing, stinging, shooting in the entire distribution of the left pudendal nerve. I underwent many treatment options, lifestyle modifications, diet changes, physical therapy, injections, acupuncture, chiropractic, the whole gamut of treatment options. And after 7 long years, I decided to undergo pudendal decompression surgery. I am 11 months post-op. I would say that before considering decompression surgery, that you also need to rule out anything and everything that you can possibly think of that contributes to this type of pain. It can be very tricky with pelvic pain because a lot of times the pain can be referred pain. It could be vessel pain, it could be ligament pain, it could be muscular pain, it could be organ pain, and working with the physical therapist and several different specialists to try to rule things out is really the only thing you can do. The only treatment option that I haven't tried, well, there are 3 treatment options that I hadn't tried prior to surgery. One would be nerve ablation, which they either heat or freeze the nerve to kill the nerve. I haven't tried a neurospinal cord stimulator, which basically kind of interrupts the nerve signals to and from the brain on that specific peripheral nerve. And pulse radio frequency ablation, which is, they're just other methods to destroy the nerve tissue and the tissue around the nerve. There's also stem cell injections that I hadn't tried prior to surgery. I wanted to leave myself with some options after surgery so that I wasn't left with nothing in case the surgery was unsuccessful. Being 11 months post-op, I will say that if you are considering this surgery, you need to consider getting a remote job, filing for disability, and having caretakers because it is a long and miserable year of pain. They say that it can take up to 2 years for you to experience improvement of the nerve. The statistics of this surgery are not very well studied. My doctor specifically has done 300 to 400 pudendal decompression surgeries, all the transgluteal method. There are other methodologies to doing this surgery, including transvaginal, transischiorectal, and laparoscopic, among some of them. And there are different success rates for different methods, but also each method has its benefits and downsides. The downside to my method is it is the most invasive method that takes the longest to heal. It does the most damage to the surrounding tissue, and the reason for this is to access the greatest surface area of the nerve. For me personally, I am just starting to feel a little bit in the realm of what I did pre-op. It's hard to say that this surgery was a game changer for my differences. I do still have really bad flare-ups of that nerve when that nerve pain is on. For my particular case, I did do some more learning about my diagnoses post-op. I discovered that I have Ehlers-Danlos syndrome, which is a connective tissue disorder that causes collagen in the body to be weak and unpredictable. So that includes blood vessels, skin, and ligaments and joints. Had I known that I had this condition prior to surgery, I probably would have opted to wait or never have it because cutting through ligaments for people with EDS is highly unrecommended. Any surgery is highly unrecommended due to the damage and the very, very slow healing rates of people with EDS. I would encourage you to do research on things like this and other genetic conditions and or other pelvic inflammatory conditions prior to having this surgery that could be contributing to your pain, because once you have this surgery, there's no going back. I did also learn about the world of vascular compressions, and I have multiple vascular compressions, which is also common in Ehlers-Danlos syndrome, among a lot of other things. There's, for me personally too, there's the issue of gastrophoresis, which happens as a result of the autonomic nervous system malfunctioning, dysautonomia, which is issues with blood circulation, heart rate, heart palpitations, things like that. So a lot of these comorbidities that go with EDS could also be contributing to my pain. The left-sided specific pain could have to do with the way that my abdominal viscera is sitting. I've discovered that I have visceral proptosis, which is basically the entire abdomen cavity is sagging downward or protruding downward in ways it shouldn't be. Many medical professionals think that this is not a problem, that when they see on imaging, they say that it's normal. And for some, it can be, for me, I feel just a very abnormal squeezing and pulling sensations when food is going through my system and in certain times of the day. This could also have to do with blood circulation as well, but many factors play into this. I've gotten a lot of questions on pudendal decompression surgery. If you are interested in asking me questions about pudendal decompression surgery, how it's done, what the process is like, you can either comment on this blog. I know you have to be a member to comment on this blog, but you can visit my YouTube channel. My YouTube channel is Embrace the World in Gray with underscores in between everything. And you can comment on my videos, and I'd be happy to answer any questions. I'm also on Facebook and Instagram. And Instagram, I am under Embrace the World in Gray as well. I'm going to be shifting the focus of my public blog to include Ehlers-Danlos, and it's going to be a more comprehensive book to include all of my symptoms, including symptoms I was ignoring due to the extreme nature of my neuropathic pain. Overall, my life has changed a lot since surgery. Not really sure if it's a direct result of surgery per se, but I had a stent placed in my left iliac vein due to a vascular compression. I'm doing different PT, and I have way more knowledge about my medical issues, and I've had the guidance of many people in support groups. So if you're one of those people who has reached out to me, I really appreciate it. And again, I very much appreciate anyone and everyone who is continuing to follow my updates. So thank you guys, and I will be back. I'm going to possibly do a second update prior to my 1 year post-op video. It's crazy to think that a little under a year ago, I was prepping for this major surgery, and I was going into the surgery in March of 2020, and coming out of the surgery, having my doctor telling me that the world is going on lockdown and my mom might be kicked out of the hospital room, and she was saying that they're going to have to forcibly remove her because she is not going anywhere. So it's crazy to think that it's almost been a year since my surgery. And thank you again for all of the support and everyone who has commented and expressed curiosity. Keep going. If you have pain, if you have rare diagnoses, figure it out yourself. If doctors aren't helping you, many doctors simply do not know what to do for certain people, and that's why you have to take it into your own hands. So thank you so much, and I will talk to you guys next time.